All right, it doesn't do you any good to take care of your face if you're not taking care of the rest of yourself, including your heart. And so Dr. Gerardo Ortega is joining us this morning with Peripheral Vascular Associates. It's good to see you.
Good morning, good to see you.
Tell me a little bit about what you guys do.
We are doctors of arteries and veins. We take care of patients with vascular disease,
Right.
which we can take care of small varicose veins or a spider vein to the largest abdominal aortic aneurysm. We can treat the patient if the patient needs a balloon angioplasty or a stent or preventive medicine. It's a comprehensive care of the patient with vascular disease.
A lot of, what we do comes with prevention. We need to make sure that we're taking care of our heart and making sure that we're healthy. What are some things that are important?
Oh, it's very important. First of all, once you have the diagnosis of vascular disease, to know what causes it. Diabetes, high blood pressure, smoking, very important.
Okay.
Lack of exercise, genetics, extremely important. So once you know that, then you know what to do to prevent that. Obviously, you cannot change your genetics, but you can stop smoking, you can take care of your high blood pressure, you can start an exercise program, you can look at your diet and see if what we are eating on a daily basis is really helping us have a healthy arteries and veins, and most likely will not. So those are the things, especially now with this season, that at the beginning of the year we can have a program and start with it.
When people come to see you, at what point are they? I mean, usually it's great to have a vascular surgeon on hand. Hopefully we'll be able to visit you, get out of your office, and then continue to make some changes in our lifestyle so that we're able to lead a much longer life. Let's talk about some of the other conditions that you guys treat too.
Yes, well, it is important because we see the patients at many stages of vascular disease, from asymptomatic, which the majority of patients are asymptomatic. We have about 5 million people asymptomatic with vascular disease without a diagnosis of vascular disease.
Wow.
And the importance of that is that once you have vascular disease, it is most likely that you will have cardiac disease, that you will have brain problems, strokes, renal failure, amputations. So once we make the diagnosis of vascular disease, that's a patient that is going to stay with us for the rest of their lives.
What are some signs or some symptoms of vascular disease?
The first sign that a patient will have with vascular disease is a problem with walking.
Okay.
Because the blockage of the artery that goes to the leg, and then the muscle in the leg doesn't have enough circulation, so the muscle cramps and the patient will stop.
Okay.
And that is very important. Now, not all leg pains will have a problem with vascular disease, but if the patient has the pain at one block, and the pain is every day, and it's in the same group of muscles, and it happens all the time, and it goes away when the patient stops, then that, in reality, is vascular disease.
Okay, that's a really important thing to point out. Once that happens, once you notice that something might be wrong, what's the next step? We come and see you?
Yes. Okay. The next step is you ask your family physician, your internist, to look into that. We can have a vascular test, non-invasive vascular test, which doesn't need any needles or invasive procedure. And then we decide if the patient's symptoms are secondary to an arterial problem or if it is something else. And the next procedure will be a more invasive angiography or a CT angiogram. And after that, then is the treatment.
Okay. And what does that treatment entail?
The treatment could be a balloon angioplasty, which is as an outpatient, which we can do it in our office, or a stent, which is also an outpatient procedure that can be done in our office. If we cannot do that and the patient has a serious problem, let's say with the foot, with a gangrene of a toe, he may require a big operation, a major operation, which we also provide in our group of 18 vascular surgeons.
Is vascular disease hereditary?
Yes.
Okay.
So it's interesting because yesterday I was talking to a student that came over to the operating room to observe, and he saw this huge plaque that came out of the blood vessel and said, well, how can I prevent that? And I said, well, tell me about your parents. He says, well, my dad died at 51, and his dad died at 51. And I said, well, you're in trouble. Are you a smoker? Yes. Well, you better quit today, because hereditary is very, very important. Unfortunately, you cannot change it.
Right.
So we should focus on the things that we can change. Weight loss, smoking, exercise, good diet, Those are the things that we can change.
And, you know, this is the time of year when people really look towards health and want to start taking care of yourself. And that is definitely something that you really need to look at, taking care of your heart and all the veins and things that lead into that to make sure they're clear and good to go. Because once you are diagnosed with a vascular problem, it's not over. There are many things you can do to make sure that you still live a longer life.
And prevent complications.
Absolutely. Well, thank you so much for stopping by today.
For having me.
I want to give you some more information about Peripheral Vascular Associates. They're here in the San Antonio area. There are several locations. If you'd like to find out more, check the website. It's pvasatx.com. Again, pvasatx.com. Coming up next.